Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, as promised, I found my book. As promised, we're going to be going over sexual transmitted infections, and to be more specific, I'm going to be covering genital warts. Now, before we get started, as always, I'm going to ask you to please, please, please support me and support this channel. How can you do that? Like this video, subscribe to this channel if you haven't done so already, and maybe you might want to think about sharing my content maybe on your social media profile or with a colleague, a classmate. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. All right, guys, so let's get started. Look at this, genital warts, and I put a star next to it. You know what that means. It's important. NCLEX expects you to know this. And if you're in school right now and you're studying the sexually transmitted infections, when it comes to genital warts, you may likely see this on your exam. You are expected to know and understand that it's caused by HPV. It's caused by the human papilloma virus. So let's talk about the etiology and pathophysiology. So HPV is transmitted by skin-to-skin contact. That's important to know. Most commonly during vaginal, anal, or oral sex, but it can be transmitted during non-penetrative sexual activity. What does that mean? Sexual activity where there's no penetration, but there's still that skin-to-skin contact, you can catch it, okay? Now, let's talk about the clinical manifestations, the signs and symptoms. By the way, guys, you may notice the setup is a little bit different for the camera, and the reason for that, years and years and years of just teaching, because even before I started doing my YouTube videos, I've been teaching nursing for years, and I always teach directly from the book because I like to teach students how to study. Well, years of doing that, how am I teaching? I'm doing this right here. I'm looking down. So years of hours and hours of looking down, I've got a big pocket of just muscle right here in my lower neck, and it's causing a lot of physical problems. So I got a book elevator so that I can look up when I'm reading. So that's why the setup looks different, okay? Just in case you're wondering. So let's keep going. Clinical manifestations of genital warts. This is that most individuals who have HPV infection, they don't even know that they're infected because they're asymptomatic. Genital warts are discrete, single, multipapillary growths that are white to gray, pink flesh colored, or can be brownish on darker skin types. So let's talk about it. Those patients who have that human papilloma virus in their body, in their system, many don't even know that they're infected because they're asymptomatic. You won't see any symptoms. But with that genital warts, the genital warts, guys, basically look like cauliflower. They look like cauliflower masses, and I'm going to scroll down because I want you to see what I mean when I say cauliflower. Look at this. Look at all of these multiple papillary growths right here in the vagina, right? Here's a better one. Look at this in the anal area. Doesn't it look like cauliflower? Or here in the penis area? So that's what I mean when I say cauliflower mass. Whenever you're reading or you're studying and you see this right here, you see cauliflower-like masses, most likely what you're dealing with is genital warts, okay? So diagnostic studies. The diagnosis of genital warts can be made on the basis of the characteristic appearance of the lesions. Just looking at those lesions, seeing that those lesions do look like cauliflower, boom, okay, it's genital warts. So most often that's how it's diagnosed, just by looking at it. So at present, the only definitive diagnostic procedure is to do a biopsy. They'll cut a piece of that cauliflower lesion and they'll look at it under microscope. They'll test it just to make sure 100% that it is genital warts. But usually it doesn't even have to come down to that. The healthcare provider just takes one look and they're able to diagnose that patient. Complications. So about 90% of warts are caused by non-cancerous strains of HPV. Now let's stop right there, guys, because they said something to us. Non-cancerous strains. What does that let us know? Because on another video, I'm going to cover HPV itself. But this phrase right here lets us know that HPV has the potential for what? Cancer. That's very important. Don't miss that. Okay, so approximately 90% of warts are caused by non-cancerous strains of HPV. However, certain strains of HPV, and they tell you specifically which ones, type 16 and type 18, can lead to cancer of the cervix, vagina, vulva, penis, rectum, and throat or pharynx. Interprofessional care. In nursing, in medicine, period, I've said this a million times, guys, it's always preferable to prevent than to treat. We'd rather prevent the patient from getting the disease or disorder than have to treat it, right? So let's talk about the HPV vaccines. Currently, they're available to protect against HPV. Now, remember, vaccines, are they primary, are they secondary, or are they tertiary forms of prevention? They're primary. Remember, primary forms of prevention, guys, would be vaccine or education, where the patient does not have it, but we want to prevent them from having it, right? Secondary forms of prevention would be something like diagnostic tests such as a mammogram or colonoscopy, where we think maybe they have it. We're going to test to see if they have it, and that test will tell us how bad it is, right? Tertiary forms of prevention would be a situation where the patient definitely has it. We just want to prevent it from getting worse. So tertiary form of prevention would be something like rehab, occupational therapy, physical therapy, speech therapy, right? But in nursing, our preference is always going to be what? A primary form of prevention, which would be education or vaccines. So I'm saying all of that to say, when it comes to HPV, it is very important that you teach the patients, and genital warts, you teach the patients about vaccines, okay? So let's keep going. Currently, 3 vaccines are available to protect against HPV. A quadrivalent vaccine, that's a Gardasil, that protects against the type 6, 11, 16, and 18. The bivalent vaccine, Cervarix, offers protection against HPV type 16 and 18, and the 9-valent vaccine, Gardasil 9, protects against HPV type 6, 11, 16, 18, and 5 other types of HPV. Now, the vaccines, I got to switch the page. The vaccines are given in 3 IM doses over a 6-month period, and they have few side effects. So the CDC recommends that all, look at that word all, when you're reading and you're studying, you see all, always, never, pay attention. The CDC recommends that all children, both males and females, be vaccinated at age 11 to 12, but vaccination can be started at the age as early as age 9. But the recommendation is 11 or 12, okay? These vaccines do not treat active HPV infection. Remember, these are preventative measures. Ideally, individuals should receive the vaccine before the start of sexual activity, and that's kind of why we start them so early, around 11 to 12, okay? Ideally, we want to start them before sexual activity, but even those who are infected with HPV can still get some protection against HPV types that have not already been acquired. Okay. And guys, that is your genital warts in a nutshell. So this was a quick video, but it was to the point and gave you exactly what you need to know for testing purposes. Please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover next or more of, or maybe you'd like to see more, maybe there's a subject, you know, every Sunday, 1 p.m. Eastern Standard Time, I don't do a lecture. I actually go over questions. Maybe there's a subject you'd like me to cover questions on. Let me know in the comment section. That engagement helps me decide on what videos to make for you, but that engagement also helps with getting me on more people's pages so that they can know about me and my channel could grow. So I ask you to please help with that. Don't forget, almost daily, guys, if you guys are interested in covering more types of questions, you guys can visit my other social media platforms such as TikTok, Instagram, and Facebook. Almost daily, I cover a variety of questions. So guys, thank you so much for watching this video, and you guys will catch me on the next video.